So the patient will have a chest pain. The patient will have a because the when the patient try to respire, the patient will develop a pain, and that pain is because of the inflammation of the lungs. And this type of pneumonia, I told you, we have different kind of pneumonia. This one is community acquired pneumonia, hospital acquired pneumonia. These are actually the pneumonia which is relevant with the environment. But we also have pathologically, we also have different type of pneumonia. For example, we have interstitial pneumonia, we have lobar pneumonia. Okay, so interstitial pneumonia mean that when the interstitium is involved. Although interstitial pneumonia is also caused by some other bacteria, mycoplasma, as well as in viral infections can also cause interstitial pneumonias. For example, COVID-19, it caused interstitial pneumonia. So it involved the interstitium. So this bacteria, this pseudomonas, sorry, this Streptococcus pneumoniae, it causes a lobar pneumonia. So the patient will have one lobe of the lung will be involved. So it may be a single lobe or it may be a multiple lobe. Okay, so that type of pneumonia is known as lobar pneumonia. So this bacterial infection can be easily treated if we treat you can say urgently, or if we initiate the treatment early, so we can prevent the chances of mortality. Because in elderly patient, this pneumonia, it may be a pneumonia. For this purpose, we use this curve scoring system. Curve 65 is a scoring system for severity, to find out the severity of pneumonia. So C for confusion, U for uremia, R for respiratory rate, B for blood pressure, and 65 is for age. So total marks is 5. So if a patient have 4, 3 or 4 score out of 5, then we treat the patient in ICU setting. So we admit the patient in ICU, and maybe we need to shift the patient on artificial ventilator. But if the patient have 2 to 3, then we can manage the patient in our ward, simple medical ward. But if the patient have 1 to 2 score, then we just need to give the antibiotic and don't need to admit the patient. So this is actually the scoring system for the severity of this disease. More detail you will study in your clinical subjects. Okay. So this is actually the diseases which are caused by the Streptococcus pneumoniae. So Streptococcus pneumoniae, as I told you, it is present in our nasopharynx, and it transfers from nasal secretion, sneezing. Okay. So once a person acquire this bacteria, the bacteria, it attach with the nasopharynx, and from the nasopharynx, this bacteria can travel throughout the body. When the bacteria when the bacteria invade into the blood, then it will cause bacteremia. And when bacteremia occur, we know that bacteremia mean blood, bacteria in the blood. So this bacteria can enter into the heart, so where it will infect the heart. Okay, so from the heart, from the blood, it can reach to the some other part. For example, it can reach to the brain. So bacteremia can cause this traveling of bacteria to the brain. So in the brain, it will cause meningitis. Along with that, we know that the nasopharynx, it has a very you can say a very thin like separation between the nasopharynx and the brain. So from the nasopharynx, the bacteria can also invade and enter into the meninges or enter into the brain directly. So when it enter into the brain, it will cause meningitis. And when from the nasopharynx, we know that in nasopharynx there is an opening of ear canal as well, eustachian tube. So when the bacteria enter into the eustachian tube, it may cause a ear infection. So ear infection is known as otitis media. So if this bacteria enter into the ear and enter into the mastoid bone, If it involve the mastoid bone, it will cause mastitis. And from this mastitis, because mastoid bone, it has a very like a thin layer which is separating the brain. So this bacteria can enter from the mastoid bone and enter into the brain, and then it cause a meningitis. So these are the different type of infections which this bacteria cause. So this bacteria can also cause a arthritis when it involve the joints. It may also cause the infection of the peritoneum, that is peritonitis. So multiple disease this bacteria can cause, and the spread of disease, it depends on the bacteremia. Once the bacteremia occur, then this bacteria can cause multiple diseases that may be a life threatening. So sinusitis and otitis media, these are the upper respiratory tract infections, and most common infections in children and as well as in elderly patients, but most commonly in children, it is very most common. So sinusitis, it is the inflammation of sinuses. We already know that. So most common sinusitis, the etiology of sinusitis is viral infection. For example, flu. We I know you all have experienced flu. Okay, every winter season we have flu. So the flu or the viral infections, they can cause sinusitis. Remember one thing, whenever there is a viral infection, whenever there is a viral infection, along with viral infection, there is a greater risk of bacterial infection. Greater risk of bacterial infection. Why? For example, this is your country. If somebody, if one enemy is trying to attack on your country, and you can say army is busy to fight with this one enemy. At the same time, at the same time, if another army, like which is another country which is also your enemy, try to attack on your country, what will happen? Your country will be captured. There will be a Your country will be captured. So the same, when there is a viral infection, your body is busy to deal with the viral infection. At the same time, when the viral attack occur, the viral, it actually decrease the lymphocytes, it decrease your immunity. So once your immunity is decreased, the same opportunistic bacteria, they cause a infection. So that is why sinusitis, bacterial sinusitis, is maybe proceeded after the viral infection. So once you develop a viral infection, maybe within 1 or 2 days the viral it will be cleared from your body, but bacterial infections may persist. So whenever there is a viral infection, there is a greater risk of bacterial infection. That is why when we treat our patient for viral diseases, we always use prophylactic antibiotic. We always use prophylactic antibiotics, because with this infection, viral infection, there is a greater risk of bacterial infections. Okay, so for this sinusitis, otitis media, I told you it's the infection of the ear. There are two kinds of ear infection: otitis interna and otitis externa. So otitis externa mean that if the infection, it occur at the middle ear, that is otitis externa. Like it is this is eardrum or tympanic membrane. If the outer canal of the ear or auditory canal, middle ear, if the outer ear, it is involved, then we call it otitis externa. Like there is a outer ear, not inner ear. But if the infection it occur in middle ear, because middle ear we have tympanic membrane and we have this incus malleus. So the middle ear infection is known as otitis interna. Okay, otitis interna. So both infections, they can the infection can cause a pus formation, as well as there is a loss of hearing, okay, very common. And this because, and the patient will have the ear which is involved, there will be no sound. The patient will not be able to hear any sound. But remember, from this infection, from this middle ear, if infection spread, it can also infect the vestibular nerve as well as the cochlear nerve. So that is why the ear infection, the patient will have dizziness. The patient have dizziness. Uh, we have a genetic disease. We have it, like my ear, I have this tympanic perforation. So there is one hole in my tympanic membrane. So so that is why, especially now, I'm very careful about it. But usually, whenever I take a shower without blocking my ear, without any cotton bud or without using any plug, if the water goes inside, it causes this middle ear infection. And for me, it takes about a month to heal. So it is very, you can say, tiring, and because one side you are not able to hear. So anyhow, this is we call otitis, although it is very common in children. The bacteremia, as I told you, bacteremia mean bacteria in the blood. And once the bacteria is present in the blood, it can travel throughout the body, and it can involve any part of your body. Okay, it can involve any organ of your body. So that is why it may cause meningitis, it may cause endocarditis. For upper respiratory tract infections, we know that upper respiratory tract infections, bacteria is already present in nasopharynx. So bacteria does not need blood to spread. So because nasopharynx is the same area where we have sinusitis, so bacteria can invade from this nasopharynx into the sinuses. So no bacteremia is required. But for meningitis, endocarditis in heart, inflammation of heart, so this bacteremia is required. So bacteremia can lead to meningitis, endocarditis, and that may also be they affect the patients who are already having a normal valves, or the patients having a damaged heart valves. And this bacteremia is most common effect of people who are having a sickle cell disease, or the patients who have asplenic, like whose spleen has been removed, or the patients whose spleen has been infected, it's damaged. So no spleen work. We know that spleen is the part of and reticoendothelial system. So it is part of our immune system. Okay, class, it is less than a minute. After a break, we will continue.